to the overall branch. Or the overall system, excuse me. As I mentioned, we are located at Westfield Annapolis Mall, so we're a little bit different of a model. We are not a freestanding library branch. We're inside the shopping mall. We had a temporary branch where we tried out this concept, which was successful, and we moved into a larger space in early 2020, and we're now the 6th largest branch. I have only information staff. If you're familiar with a typical public library configuration of staff, there's usually circulation staff and information staff. At Discoveries, we have 12 information staff full-time. We do have a smaller circulating popular collection than other branches, more in the bookstore model, and we have a high visitor count every month, just by virtue of our location and a lot of new people being introduced to the library because they're at the mall for other things. And as I mentioned, we do a lot of programming for the library system out of our branch. So in terms of understanding what our customers need, we do a lot of work to understand how the library can meet the needs in our community. Let's talk about a few of those ways that we gathered information. And all of these have played into the decisions we've made to start the pantry and to make modifications to the pantry to better meet the needs of our customers. So obviously working with customers one-on-one every day, we learn a lot about what they need. And as we're helping people connect to resources in our community, we're learning about gaps in services, whether it's the open hours of food pantries or other services in our community, or just lack of services, because people are asking us questions about how they can access different services. We're also learning about what services don't exist and identifying those gaps in our community. We use focus groups in our library system to learn more about our customers. For example, a branch near Fort Meade here in Maryland has done multiple military family focus groups to really learn what that population needs from the library. We've also done mall employee focus groups here at Discoveries so that we can learn more about how we can be a better partner in our community. So we really see the mall first as our first community here at Discoveries, and then larger Annapolis. We also have community meetings that branch managers, including myself, regularly attend. Our county, the county executive, or our county council members have led meetings about budget, about other resources, building projects. All of those are ways for us to gather information about what our community sees as their priorities and what they need from both the library and the government. We also use quantitative data sources. We have a community foundation and the Partnership for Children, Youth, and Families in Anne Arundel County that produce a document periodically called Poverty Amidst Plenty that does help us better learn about the gaps in services in our community, what the overall population in our county are facing. So that tells us information about food deserts, about school readiness, about all different types of information about our residents, and that can help us look at library services and identify how those two things connect. We also have many partnerships specifically at Discoveries and as a library system with our local schools, with the food bank, and all of those relationships and conversations that we have with partners help us learn more about what we can do for our community. We really see the library as a connection place. Whether you need access to books, you need access to information, or you need access to diapers, as we'll talk about in a minute, the library can be that connector. So during our pandemic response at our library, we really thought about tailored branch services. This is a tenet of our strategic plan. at Anne Arundel County Public Library that each branch is able to look at their community, use those data sources that I just talked about, and really tailor the services that that branch provides to best meet the needs of their specific community. So every branch doesn't need to be the same, but we are all serving the county in different ways, tailored to the people that are coming to our branch and the community where our branch lives. So you can see in this slide that we did, we hosted food giveaways with partners during the pandemic response. We had mall worker specific food giveaways here at Discoveries. We went to other food distribution sites in the county, whether it was schools that were providing school lunch, drive-up fashion while schools were closed for the pandemic. We went there and handed out library information, or at other or community locations where we could spread the word about the library could offer. Many of our branches have little free pantries outside. So this is just another way that some branches have tailored their services in the wake of those mobile food deliveries that have largely gone away as we've come out of the pandemic response. So these are a partnership with the Caring Cupboard in our county, and some branches have these that are take food or leave food, whatever, just like a little free library, but a little free pantry. We also have an evolving partnership with the Department of Social Services, who provides social worker hours at many of our libraries. And that is a way that us in partnership with the county government are able to support our customers. We can also use the information, obviously not specifically tied to a family, but the social workers also help educate staff about the needs they are seeing in the community. So let's talk a little bit about this need. This is a picture of us, one of my staff members, explaining Summer at Your Library program to Pantry this past summer. So let's talk a little bit about diaper need in our communities. Diapers are a really essential part for a baby's health and development and growth. It's in many ways as important as the love of the family. So let's talk about that. There are, this is Maryland specific data taken from the National Diaper Bank website. So you can find specific data for any state in the United States if you want to learn more about specifics for your location. There's 286,000 kids under age 3 in Maryland, and 12% of those kids live in families earning less than 100% of the federal poverty limit. So that federal poverty limit in 2022 for a family of 4 was $27,750. So for a family of 4, obviously that doesn't seem like much, but there are so many families, even 17% of kids under age 3 are living in families that earn only between 100 and 200% of that federal poverty level. So that kind of gives you a little bit of a picture of Maryland, about the kids that live in Maryland. Nationwide, SNAP and WIC benefits, all those federal benefits cannot be used to purchase diapers. So families are having to use other income not provided by the government to buy diapers. So 1 in 3 families, a lot more than 12% actually struggles to provide clean diapers for the family. Diapers are expensive. I never realized how expensive diapers were until we started this program, and they're disposable. So you're always having to re-up and buy more diapers. Lack of diapers can make daycare inaccessible, because if you can't provide a back store of diapers to your child's daycare provider, then maybe they can't go to daycare or preschool that day. And if your kids can't go to daycare because they don't have diapers, then that may negatively affect you going to work. And then it becomes this cycle of inability to meet the diaper need, so can't utilize childcare, so you can't go to work, so you can't use, earn the money to buy the diapers that would allow your child to go to daycare in the first place. So you can see how this really affects so much more than just the child not having a diaper. Menstrual products are also a huge need. And I could talk about a lot of this stuff for a long time, but let's just talk a little bit about menstrual products. So menstrual products are not a luxury like diapers. They are something that you need to purchase if you menstruate or have access to otherwise. So they are a basic need that needs to be met. There is a lot of stigma around discussing menstruation and needing supplies. So people who menstruate may feel like they can't ask for help in this area because that opens a broader conversation. There's a lot of emotional burden tied also to not having menstrual products at your disposal. This information is coming from the Alliance for Period Supplies, and I'll also talk about some other resources that you can use to learn more about this. So 1 in 5 American teenagers who live in poverty lack menstrual products. Some states have passed bills to make menstrual products available for free in schools. Maryland recently did this, and other states. I just saw actually on Instagram this morning, there's a nonprofit called the Period Movement. And so this morning they had a slide of 5 different states that currently are trying to pass bills to also have menstrual products free in schools. A quote from a recent ACLU study called The Unequal Price of Periods, Menstrual Equity in the United States showed that 2/3 of low-income women in St. Louis could not afford menstrual products during the previous year. And when you can't afford menstrual products, you're forced to think about other alternatives. So you might feel like paper or newspapers or diapers that your children might need as well are your only option if you don't have the ability to access menstrual products. Like diapers, as the cost of everything is rising, the cost of menstrual products is also rising. Last year, you may have heard about the formula shortage, but there also was for a stretch of time a tampon shortage as well because of the products needed to go into the manufacturing of those. Many states also have a tax on menstrual products. Maryland and DC recently removed that tax. So when you buy menstrual products, you are not charged the tax, but obviously still charged the amount to purchase. Like diapers, you cannot use federal benefits to purchase menstrual supplies. And shelters, emergency response centers often don't provide menstrual products for their residents, and it is not consistently provided at correctional facilities in the United States. So all of these are problems. I wanted to mention that the city of Washington, D.C. recently passed a bill last session in their city council that is going to make menstrual products free in all public buildings. And they even went so far as to make it law that those will need to be green menstrual products, so no plastic involved. Also, aspirationally, it's interesting to note that Scotland just passed a bill to make menstrual products free for the entire country. So there are ways that we can work towards legislating more access to menstrual products. So I mentioned why it's important that people have access to diapers and menstrual products and other hygiene supplies. This is really an equity issue in many ways. So not having access to period products and diapers extends to so many other aspects of life. I mentioned not having access to childcare if you can't provide diapers for your children. There also can be lasting emotional or medical impacts from not having access to menstrual products, toxic shock syndrome, reproductive tract infections if women are using menstrual products in the wrong way for too long, or using a substitute to take the place of conventional menstrual products can have lasting medical effects on them. Students miss school because they don't have access to menstrual products. Adults might miss work. There's a lot of research out there now coming more and more to the forefront about the dignity of being able to go to work in clean clothes. If you don't have menstrual products, you might also just use nothing, which can affect the clothes that you might wear to work and then have a ripple effect in that way. When your basic needs aren't being met, you cannot fully engage in other opportunities. So whether that's school, work, the library, or other fun things, because you are so focused on having your basic needs met that all those other things don't matter in that moment. So this need, coupled with the information that we saw from our customers, led us to open the community pantry at Discoveries. So let's talk a little bit more specifically about our pantry. As we said, 1 in 3 families struggle with diaper need. We saw how many kids in Maryland are living below the federal poverty line. And all of those things came in to our decision to have this community pantry. I mentioned that we opened this new Discoveries library space in early 2020. When I designed the space, I left this space, which is now the community pantry, for something of this nature. Initially, we thought that it might be a food pantry in partnership with the Anne Arundel County Food Bank. But as soon as we started talking about that, COVID hit, we were locked down for a while, and then we kind of had to pivot and figure out what was going to work for us, but also the food bank has been under much stress since then. So at that point, they weren't necessarily able to commit to a partnership with us. The other thing about a food pantry is that things expire quickly. So that part of the pantry aspect was something that we didn't want to commit to either at that point. So we decided that we wanted to have what started out as a baby pantry, but now is just a general community pantry, because we wanted it to be accessible to anyone who needs hygiene supplies. So we have a pantry space, and we distribute diapers, wipes, menstrual products, incontinence supplies, shampoo, soap, toothbrushes, toothpaste, diaper cream, nursing supplies, formula, and toothbrushes and toothpaste were not originally on our list, but were a major request from customers. And so we added toothbrushes and toothpaste to our list. We have this community pantry space that was outfitted with shelves by the Container Store when they opened in the mall. we were very lucky to have that partnership to get us off the ground. We opened in July 2021. We were open every Saturday from July 2021 through December of 2022. In December, we needed to make some changes to the format of the pantry because we were seeing such high need, and we weren't able to keep up with the need in terms of what we were stocking. So we switched our pantry hours starting in January last month to we're just open the first Saturday of the month and the first Tuesday evening of the month. So we don't ask anything of people that come to the pantry except that they get a library card. As I mentioned earlier, if you live, work, own property, or go to school in Maryland, you can get a library card in Anne Arundel County. We use the library card as a way to match their order with their order sheet when they come to the pantry, but we also encourage the use of the library card while they're here to utilize library resources. We have family story time while the pantry is open so that hopefully families will be able to spend some time going to family story time and engaging with some of those school readiness and other aspects of being a family together. But we're also finding that our language learning resources, some of our nonfiction collection, all are circulating well during pantry time. So we, in the beginning, had just library staff staffing the pantry. With so many families every Saturday, that kind of got out of control, and we implemented a volunteer program. So we have volunteers that help us during the week to stock the pantry, and also on pantry days to help us fill the bags. The majority of our families are from the Annapolis area, Anne Arundel County, but then we have families coming really from all over the state. So we serve between 60 and 70 families a week for most of the time. This year, especially as we move towards those pandemic SNAP benefits running out in March, we are seeing about 100 families each time we're open. About 60% are English as a second language families. So we have a high Spanish speaking population that's coming to the library for pantry distribution. This was a great way to reach a community that we were previously having trouble getting to come into the library. We do have a Spanish language collection for adults and children that was underutilized. That's improving a bit, but my Spanish speaking staff are really forming relationships with these families and introducing them to what the library can offer to them. We have 51 different zip codes of people that we've served. And in our first year, this is the data of how many packs of diapers we gave out. So we give a pack of diapers for each child each time you come to the pantry. And then you can pick from a list of other supplies depending on what we have in that day, and everybody gets a pack of wipes. So we have people too that are not coming for children, that are just coming as adults or teenagers, and they maybe don't need diapers at that point, but they can take part in utilizing the other hygiene supplies that we give out. So let's talk for a minute about how we've sustained supplies. We've really built in a number of different ways to keep this going. I mentioned that we were open every week from July 2021 through December 2022. Last summer was rough for a number of reasons, and even all of these different donation avenues were not enough for us to have things every week for our customers that needed it. So Diaper Needs Awareness Week happens every year in September. So for the past 2 years, we've done library system-wide drives at all of the branches to help support the pantry. We have partnerships with a lot of local community groups, including the Junior League of Annapolis, the YWCA, other businesses that want to contribute. Realtors like to have drives for things. And so we have a whole packet that we give to donation partners about running a drive, about what we need. And a lot of this, most of it actually has been organic, people hearing that we have this and wanting to know how they can help. We also have a small grant from Anne Arundel County from the American Rescue Plan Act money to supplement supplies, but we are primarily donation based. So donations are great, but our pantry is only so large, and at these times when we have these large drives, the question came, all right, what are we going to do with this stuff now until we're able to give it out? So that can definitely be overwhelming. And we have turned part of our conference room into a pantry storage area. You can see the volume of supplies here that come in from some of the drives. So we utilize volunteers heavily in helping us sort those, label all the different sizes of diapers, and stocking the pantry. So it's not just volunteers or organizations bringing us the stuff. We also utilize them to help us sort the stuff. Because as you might imagine, this takes a lot of staff time, more than I imagined, but we are reaching so many new families, bringing them into the library and helping them see that the library is that connector to the things that they need, that we have just taken this on as a mission of our branch. So it definitely is overwhelming at times when there is so much stuff, but that's a good problem to have. We've had a number of things that we've done to kind of enhance pantry distribution. So we've given out rapid COVID tests and masks when we have them at the branches, putting some in each bag. Back when vaccination appointments were a big hot item, when we had clinics in the branch, or we had the health department and Centro de Ayuda, which is an immigration organization in Annapolis, were coming to help people sign up for vaccination appointments. We have a take a coat, leave a coat, which is like a little free library for coats, essentially, during the winter. Even this winter, when it hasn't been so cold, that's been getting regular use. We did summer slide bags last summer for our pantry families, which included a math workbook, art supplies, flashcards in English and Spanish for new sight words. We do regular book giveaways too, as you might imagine, as part of the pantry, because we want to support that learning at home. We also, for the past few months during pantry distribution days, we've been having pro bono lawyer help, especially for Spanish-speaking customers in the library. So you can, while you're here for pantry, you can sign up for an appointment, a 20-minute consultation with the lawyer to help you with immigration issues or other legal issues that you might be facing, and get that resource right while you're here doing other things at the library. We've also had a number of other projects come from pantry distribution. Really, this has just grown in many ways that are, I don't know what the word is for it. I just think they're very beautiful. We have often gotten donations of things that are not on our wish list for the pantry. I did forget to mention that we also have an Amazon and Target wish list. So if people want to buy things and have it sent directly to the branch, that's a great way that we get donations. But for example, we had a customer donate 100 pairs of socks, new socks, and we were like, okay, we'll figure out what to do with this. So last winter, we ended up making overnight packs for the winter relief shelter in Annapolis. So there was hygiene supplies, but also the socks, a little note from the library about just a motivational note, other things, and we dropped those off. That's the picture on the right there. We also have made period packs for people experiencing homelessness and in treatment facilities in Annapolis. So those are just quart size Ziploc bags. So you can see the girls on the left there helped us pack them with some tampons, pads, panty liners, hand wipes, hand sanitizer in them. And so those are kind of on the go period packs. We started a second Saturday service project for teens. So this started out of the need to pack those care packages and period packs. But now we have a partnership every month on the second Saturday where we work with a local organization to get teens service hours and to fulfill a need of that organization. So we also do outreach with other branches that might have resource fairs or food distributions and go and support them with pantry supplies. So this is our pantry in other forms. One of our local branches has a regular baby shower for new mothers where they bring in county resources, other organizations to distribute supplies, information that new parents might need. And so we have gone and distributed size 1 and newborn diapers at those events. So that's one way that you can kind of scale this pantry model to work for you. Our branches, 2 of the branches that have social worker hours from our county do have a social worker facilitated pantry. So it's not open regular hours like ours is, but it's accessible to those families that utilize the social worker at those locations, or they can people can call and make an appointment with the social worker to access the pantry. We were also lucky enough in this last budget cycle to be able to have a small budget request from the county to be able to offer free period supplies in all the library bathrooms. So we are making small steps towards having these supplies free for the people that need them. There's other options too. There's a picture here of menstrual products for all. So this is a picture from my teen room here at my branch. We just have a basket with some of those quart-sized bags packed with menstrual products. It's there for whoever needs it. You don't have to ask a librarian for help. We haven't had issues with people pulling them apart and doing other things with the products inside, but we refill this once or twice a week. And so people are taking them from the teen room. You can also have pantry resources on mobile vehicles. I suggest if this is something that you're considering, you think about whether diapers, which take up a lot of room and you have to have many sizes, are the way that you want to go, or whether hygiene supplies like menstrual products and shampoo, soap, deodorant, toothbrushes, and toothpaste are where you want to start. So you could have those on mobile vehicles. You can see a picture here from Forest Park Public Library, which is in Illinois. A lot of libraries are using library furniture to create comfort cabinets or resource cabinets. So this one, they have a great article on their website on Forest Park Public Library, so you can go there and find more information. But they have menstrual products, lotion, Band-Aids, chapstick, tissues, wet wipes, sunscreen, and anybody who needs them can just pull out those resources when they're at the library, without judgment, without needing to talk to a librarian. And that's a kind of a low-key way to help meet some of these needs. There's also a number of college and university libraries that have similar comfort cabinets in their libraries at the schools, to help meet the needs of students on campus. You can do this too. Like this is kind of a large scale way. It could be bigger, believe me. But what we're doing is we have a full room full of stuff. We devote staff time every week, to supporting this, to working with partners, to doing outreach, to making sure the flyers are in the right places in the community, doctors' offices, with all the county agencies, other branches. So I would just encourage you to think about what the gaps are that your customers are seeing, prioritize how you can meet those needs easily at your branch or your location, and assess your capacity, and really see how you can be that conduit between what people need and what the library can provide. Overall, the outcomes of this, hopefully we are improving the health and dignity of those in need, of our customers. We really have seen that this has only increased the trusting relationship between our customers, new and old, and the library. These customers know that they can come here, and we can help them. And if we don't have the supply that they need, or we don't have food at our pantry, we have a list of pantries in the area and what they provide and when they're open, and we'll help you figure out how to get there to get what you need. This allows families to focus on other priorities, like I mentioned, story time, or checking out books, or working on that summer slide from school. So you can better focus on those opportunities when you have basic needs like having shampoo and diapers at your house. And as I just mentioned, we're connecting customers with other resources in the community. There's a lot of things we don't provide, but we try as a staff to know very much where customers can go to get that, and spread the word, whether it's by inviting community partners to be here on Pantry Day to hand out their information, or sticking a brochure about English language classes at the community college in each pantry bag on a Saturday. We're really connecting customers to other resources in the community. So really the moral of the story is libraries are about connection. I believe this very strongly. We're connecting people to books if that's what you need. We're connecting people to each other, to resources, and in the end, if you can, to items that help meet their basic needs. And that's what we're doing here at Discoveries. So that is the end. I can see a number of questions popping up. So I'm happy to take those. And also my email is here. So if you want to contact me after, I'm happy to talk more with you one-on-one. Okay, Faith, it's your turn.
Thank you so much, Rachel. We really appreciate you coming on and talking about the program that you have at the Discoveries, and just being available for this. So I'm going to share my screen briefly because I want to put up the evaluation link that we're going to ask everyone to fill out when they get a chance. Let me switch my screen. Boom, there we go. So we're going to do that, and I'm going to pull up some of the questions that we had in the chat here. So everyone's saying thank you, thank you, thank you. Thank you all for attending. Thank you too for participating. So I'm going to try to correlate some of these. One of the questions, one of the categories we got were kind of operational. So first and foremost, someone asked how you actually pay the rent for Discovery. So if you could give a brief, because they don't know the story.
Sure.
And then the other thing operationally with that is how much staff time is actually dedicated to stocking the pantry.
Right. So Discoveries, as a branch of Anne Arundel County Public Library, we do pay rent to the mall for our space. So most of our branches the buildings are owned by the county. A few of them, including ours, we rent the space from the mall. So the county real estate office, negotiated the lease and pays the rent. So we have a 10-year lease here at the moment for Discoveries. In terms of staff time, it really depends on the week. We have strongly tried to incorporate those volunteers. We have that trusted core volunteer group that come in every week. We have somebody that comes every Wednesday to go through the donations that we've got that week, stock the pantry. We have a pantry meeting every week with staff. So I mentioned that I have 12 staff at Discoveries. 5 of us, including myself, are on the pantry team. So that core group, somebody is responsible for donation drives, somebody is responsible for the outreach portion, somebody is responsible for the volunteers. And so we have that work all divided up. It does definitely take staff time. Quantifiably, I would say probably it takes maybe 10 hours a week amongst the 5 of us on a good week if we're lucky. Just liaising with our partners, trying to make sure that we have things ready for the upcoming week. Obviously, when we're open for pantry, that's 2 solid hours of both staff time and volunteer time. As you might imagine, like 80 to 100 families in 2 hours. We're just like going with greeting people, having them fill out the order form, filling the forms, talking to them about library resources, answering questions, all of that. So it definitely is an impact on staff time.
Great, thank you. Another question we had, and I think you answered it, but maybe if you could just kind of summarize it, was regarding into funding of these projects. So I guess when you first started, maybe like how you got the money, and then I know you spoke a lot about donations to kind of keep it continuously, but maybe, I'm not sure,
Yeah.
and Carol, clarify in the chat for me. I don't know if you're asking if there's a line item dedicated to buying this, or if you get enough from the community to do this. So there's no library line item, correct?
Correct. We do not have a library line item. We have the ARPA money from the county, which is a limited time grant, was a 3-year grant to help supplement of the $500 a month. Everything else, and really how we started, we just said, like, we need donations. Here's a list of what we need. And people have been extremely generous to help fulfill that need. We have some older customers that every week when they come to check out their books, they always bring 1 pack of diapers. Like, we have one lady that is very into it, but all she can do each week is just 1 pack of diapers. But she's so excited every month or every week to bring us that 1 pack. And so we have people like that, but then we also have large organizations or businesses. We have had some businesses do like a roundup fundraiser where you make a purchase, and then you hear that all the time at the grocery store, but it was small business, say, asking people if they wanted to round up their purchase, and then they took that money and bought for us what we saw as a high need at that point. So it's also been great in introducing all these other partners to what the library does and what our needs are, broader even than just the pantry, because people all the time ask us questions about, like, is the library paying for this? How does the library budget work? All of those things. So it's been an opportunity also from the education aspect to get these partners to better understand how the library operates, and just that if you live or work on property in Maryland and can show us some kind of ID, you can have a library card. So it's been beneficial in those ways. The shelving in the pantry itself was donated by the Container Store. They do a service project whenever they open a new store. They opened a new store here at Westfield Annapolis, kind of coinciding with us wanting to open the pantry. So they did a whole, social media push and everything about putting up the shelves and all of that. And so that was a donation from the community as well.
Great. And there was since you mentioned the library card, there was a comment in the chat about someone wondering what you did for families or persons who may not have like a fixed address, how you worked around that library card issue and were still able to serve them.
I know probably some people from administration work here, but we try to work with people. So we accept other forms of ID. If you have any mailing address whatsoever, we don't really mail anything from the library anymore physically. So we try to work with people to make them be able to access the pantry. We also in Anne Arundel County have a program called the SAIL program, where all the kids enrolled in public school and some of the private schools have a library card just by virtue of going to school in Anne Arundel County. So you can use your child's card too, if that's the library card that you have. If you can't provide anything now, we'll let you use the pantry and work with you in the future to get you a library card. That's just the best way that we found to kind of both introduce people to library resources, as I mentioned, and make them aware of all the things available to them, but also we had to have some system of matching orders to people and all of that stuff. So yes, I see Kathy say a shelter address works as well. Yeah, if you're staying at a shelter or you have temporary housing, we'll just put that on your library card and make it work. So we want to be accessible. A lot of pantries in our county honestly ask for a lot of documentation, which they need to do to get federal funds and all of that. The library doesn't ask for that at this point, because we want to be as accessible to everyone as the library is, in terms of the pantry being available to you. So we try to make it as low impact as possible on people.
Thank you so much. And thanks, Kathy, for that input there. There was another question. I'm making sure that I'm trying to get most of these. Initially, when you proposed this to your leadership, how was it received? I'm assuming you went to your, to the system director and said, hey, I have this idea, or were you able to kind of do that freely as a branch manager?
In terms of, I would say discoveries in general, our branch is not the normal library model. So we, in kind of envisioning what this branch would look like, because we're in the mall, because we have a smaller collection, because we need space for all this programming, I was able to propose other ideas that I wanted to try. The entire branch itself was kind of a pilot, and so integrating these other smaller pilot projects into our branch and seeing how it works for our whole system. How could this be replicated on a different scale depending on your space, capacity at the branch, need in your community, all of that. We were just really a test case for it, and so they trusted me and my staff to try to figure out how we could make this work. And we've been evaluating as we've been going along and seeing what's working and making changes. And they're been very supportive of that, because our whole system is really dedicated to equity and to making a difference in our community and being that community connector and community space where everyone is welcome. And so this just aligns well with all the other values that we try to emulate with all of our projects and services.
Great. And then the next question was, is there a limit or cutoff to the families who visit multiple times? Because you've seen other organizations that have caps or limits on their donations, and help?
Yes. So when we were open every week, you could come every week. Now that we're just open twice a month, so first Saturday from 10 to noon and first Tuesday evening from 6 to 7 p.m., the maximum number of times you can come in a month is twice. So I didn't mention this in the presentation, but although we have open library hours, something that's a little different for us than a typical food pantry is even when the pantry is closed, the library is obviously still open. So if you come on off pantry times, we do fill your order on a 1-by-1 basis, but you can still just come twice a month now.
Great. And then related to that, Zamora asked, how do you control or monitor the number of visits per month? And I'm assuming you tie that to the library card, because I remember
Yes.
you talking about the sheet matching up and things.
Yes, yeah. So because we kind of keep the order forms, because we also, for inventory purposes, to see trending items, what we're giving out a lot of and less, we really have that data also from supplies, but then also keep track of number of times each library card has come so that we can understand repeat usage. Are we getting a lot of new people? We always know a good pantry day is when, well, a good pantry day, but a busy pantry day is when we also do 15 new library cards on pantry morning because we have new people coming to the pantry. So we analyze all that data. One of my staff on the pantry team is in charge of keeping the database and all that track of inventory and customer usage and all of that. So we do pay attention to that. People learned when we were open every week, and then we kept running out of things that, like, if you came at 11:30, we probably wouldn't have any pull-ups. We probably wouldn't have 5, 6, or 7 size diapers because those are high need items. So it was an education thing for the customers too, in that we're different than a store. We just don't have everything all the time. And so we're based on donations and having those conversations with customers so that they understood how the pantry is run and where everything comes from. And so that creates the trust too, and a better relationship, so that they understand now when we had to reduce the number of times we're open. The reason that we had to do that was because we want to have what you need when you come. But when we're open every week, we just can't maintain that. So I don't even remember what the original
Yeah,
question
there was, I'm going to try to fold in these last two because I know that. Thank you all for making yourself available. You as well, Rachel, thanks so much for coming and talking about this program, and thank you all for attending. But the last parting questions was, and it's more, I think it might be a question comment asking, do you have family resources centers in your area? Because they have a strong network and it helps by sharing resources of what might be available to the family. So I'm assuming that might also be related to being able to scale that. I guess if you have resource centers, you could kind of serve as an outpost.
Yeah, we do. We have Annapolis Family Resource Center, which we do work closely with. We go and do outreach library visits in general. And they have a lot of resources there, from GED classes to story times that they do themselves. And so we do share supplies with them, and then also with our local Judy centers and other, other organizations that are focused on the early childhood aspect. So getting the word out, but then also sharing resources. Even the local Judy Center had an excess of one size of diapers. And so they brought them to us because they knew that we could get them into the hands of families that needed them. So that's a great point, that knowing what other organizations in your area already do this type of work or already serve this this need is important, because you don't want to duplicate effort necessarily, but working together to understand even what they're seeing as the gaps that they can't meet. So then what's the library's place in that community ecosystem is important.
Sure. And our last question is, what do the order forms contain? I'm assuming they want to kind of know what
Yeah,
the tick sheet looks like
I
to
should have
put
brought
in
one
the
in.
order.
It essentially is an introduction to the pantry at the top. We scan your library card, just print out a little slip with your number, staple that to the order form. There's a section at the top where you give us your child's name and birth date and then what size diaper they need. So there's 4 spaces for 4 different children at the top. And then there's a list of adult items that you can choose from. Depending on what we have, you can choose 1 thing from that list or 2 things from the list. So the order form is kind of reactive or responsive. And then there's a children's list of things. So the adult list is toothbrush, toothpaste, adult shampoo, because of course there's kids things for all these, all the different menstrual products, incontinence supplies, and you can choose a combination of things depending on what we have in stock at that point. And then we fill paper bags. We recycle paper bags from the grocery store and buy some larger shopping bags as well. And then we have a second copy of your library card number that we staple to the bag. And then we deliver out in the library to the customer who's ordered. So the order form's pretty basic. We came up with it ourselves, and is responsive to what we have on the shelf at that month.
Awesome. I just want to thank you again so much for coming and presenting all this program. It seems that the attendees we had really enjoyed it, and just thank you so much for sharing with us your program. And we look forward to seeing more of what the Discoveries is doing.
Well, thank you so much. I hope everyone has a little bit of confidence now to understand how maybe they can do something similar, but I know everybody's doing wonderful things in their libraries already to help meet the needs of their customers. So thanks for learning more about what we're doing.
Great. Thank you all so much. Thank you for coming, and we'll see you on the next webinar. And we'll also be emailing out the recording to this, as well as Rachel's presentation slides as well. So thank you all, and see you at the next one.
Thank you.